Gentlemen, you have been misled for most of your life. They told you that masturbation was dirty, that it was shameful, and that by the time you reached 50, it was something you should have left behind. But what if I told you that this one act, this one part of yourself, might actually hold the key to staying healthy, vibrant, and emotionally alive after 60? Not just sexually, but mentally, emotionally, even physically. My name is Dr. Mason R. Holbrook. I am a men's health specialist and professor of urology, and I have spent more than 30 years helping older men like you reclaim what society tried to take away. What you are about to hear may challenge what you have been told your entire life. But if you stay with me until the end, I promise it could change how you live the next decade. This is not a video about pleasure alone. This is a video about function, vitality, strength, and healing. You deserve to know the truth. So if you are ready to reconnect with a part of yourself you may have been taught to abandon, take a breath and stay with me, because the next few minutes may be the beginning of your return to life. And if you believe more men should hear messages like this, subscribe to Elders Motive now and turn on the bell. Leave a comment with the number 1 if this resonates with you. If not, leave a 0. Either way, I want to know you are here. Now let's begin. Secret 1. Mindless masturbation leads to numbness and erectile dysfunction. This is where it all begins. Most men do not talk about this, not even to their doctors. I have had hundreds of men, many in their 60s and 70s, come into my office and sit across from me, eyes down, voice low, and after we build trust, I ask them something simple. Do you still touch yourself? The answers vary, but the tone is always the same. Yes, but I do not feel much anymore. Or, it only works a certain way now. Or worse, it is like my body forgot how to feel. What these men never knew was that their body had been trained into dysfunction. The way they had been touching themselves for years, quick, mechanical, emotionless, had created a loop in their nervous system. The same hand, the same pressure, the same routine, over and over. They were not relieving stress. They were rewiring their brains. The consequences: loss of sensitivity, erectile dysfunction, delay in climax, even the inability to climax at all. But it goes deeper than that. When this becomes your routine, intimacy with a partner begins to feel strange. You start to withdraw. You think something is wrong with you. Your confidence drops. You avoid mirrors. You begin to feel invisible. And that is how men disappear slowly, not physically, but emotionally, spiritually. But the body can learn again. The nervous system can heal. You are not broken, but you may be overtrained in the wrong direction. You need to slow down, connect, be present, not just to sensation, but to your own heart. Secret 2. Masturbation reduces prostate congestion and inflammation. Let me tell you about David. David was 68. Stoic, proud, strong. He came to me because he was waking up 5 or 6 times a night to urinate. He felt pressure, a dull ache deep in his pelvis. He thought it was old age. He thought it was normal. I asked him something most men never expect to hear. When was the last time you ejaculated? He looked at me confused, said, years. Since my wife passed. I thought I was supposed to stop doing that. That is the myth. That after a certain age, you just turn the system off. But the body does not work that way. The prostate continues to produce fluid. If it is not released, It builds up. This creates congestion, inflammation, discomfort. Over time, it becomes a real health risk. Frequent ejaculation helps clear that buildup. It reduces pressure. It improves urinary flow. It even helps reduce the risk of prostate cancer. There is a study from Harvard. It followed nearly 30,000 men. It found that those who ejaculated 21 times or more per month had a lower risk of developing prostate cancer. David started again, not out of lust, out of care. Slowly, his symptoms faded. He slept better. His eyes lit up again. He had reconnected with a part of himself he thought was lost forever. You would not ignore your heart or your blood pressure. Do not ignore your prostate. Secret 3. Shame around self-touch damages your mental health. Most men over 60 carry shame, and they do not even know it. It shows up in their posture, in their eyes when I ask questions about touch, in the nervous laugh, the quick subject change, the deflection. They were raised in a time when touching yourself was seen as wrong, shameful, dirty. That message did not disappear. It buried itself in your bones. But here is the truth. Regular, healthy self-touch regulates your hormones. It reduces cortisol, increases dopamine, boosts oxytocin. It helps with sleep, mood, cognitive function. But shame does the opposite. It increases stress. It raises inflammation. It makes you anxious. It isolates you. It weakens your immune system. It damages your heart. I had a patient who had not touched himself or been touched by anyone else in over a decade. He was depressed, numb. He believed that chapter of his life had ended. But we worked slowly. No medication, no pills, just presence. A simple reconnection to his body. And within weeks, his spark returned. He laughed again. His blood pressure dropped. He walked taller. This is what shame robs you of. Your dignity, your presence, your identity. Secret 4. Testosterone is stimulated by sexual activity. Even solo, you have been told that testosterone fades because you are aging. But that is not the full truth. Testosterone fades when your body stops believing you need it. When you stop touching yourself, stop engaging with your sexual energy, your body begins to turn the dial down. Your muscle tone drops. Your belly grows. Your sleep suffers. And your drive to live starts to fade. I had a patient named Frank, 73, retired firefighter. Said he felt like a shadow of himself. His testosterone levels were at rock bottom. Not because of age, because he had stopped caring for his sexual self. We rebuilt that connection. Not with anyone else, just with himself. Slowly, intentionally, with presence. And over time, his numbers rose. But more importantly, his posture changed. His voice strengthened. His spirit came back. Your body listens to what you pay attention to. If you ignore it, it goes quiet. If you honor it, it returns the favor. Secret 5. Erectile function is a use it or lose it system. Many men say, I am not having sex anymore, so it does not matter. That is the lie. Erections are not just about intimacy. They are about blood flow, nerve health, vascular integrity. The penis is made of muscle and blood vessels. If you do not use it, it atrophies. The tissue hardens. The vessels narrow. Oxygen flow drops. And eventually, it no longer responds, even if the desire returns. This is not just about aging. It is about disuse. You can preserve the system by keeping it alive. With touch, with arousal, with presence. Not for performance, for health, for identity. You are not too old to feel alive. Secret 6. Pornography changes your brain. But you can take control. I know this is uncomfortable, but it is important. Porn today is not what it was 30 or 40 years ago. It is intense, fast, overwhelming. It hijacks the brain's reward system. It trains you to need more and feel less. I have seen men lose all connection to real touch. They become numb, frustrated, isolated. They do not understand that what they turn to for relief is what has stolen their ability to feel. But this is not permanent. Your brain can be rewired. You are not broken. You can reconnect with real sensation. It takes time, patience, and honesty, but it is possible. And it starts when you decide to feel again without screens. Secret 7. Isolation is the most dangerous mistake. Peter was 76. Had not been touched in over a year. Not even a handshake. He did not speak with sadness. He spoke with resignation, like it was just the way things were now. But touch is not a luxury. It is a biological necessity. Without it, the nervous system shuts down. Sleep suffers. Stress rises. Immunity drops. The brain dims, not because of age, because of abandonment. The body begins to die in silence. When you stop touching yourself, not for pleasure, but for presence, the brain registers it as withdrawal. And withdrawal becomes self-erasure. But you can come back. I have seen it happen. I have watched men return to life through the simple act of caring for their own body again. In conclusion, the golden protocol: you are not broken. You are not invisible. You are not too old to begin again. Every system in your body still wants to work, still wants to feel, still wants to live. And you do not need pills. You do not need a partner. You need presence. That is why I give my patients what I call the golden protocol. 10 minutes a day. Quiet, respectful, intentional self-connection. No performance. No pressure. Just breath, touch, awareness. It becomes a turning point. Because when a man touches himself with dignity, his body remembers, his mind softens, and his spirit returns. You still matter. Your body is still yours. And your time is not over. It begins again, right now. Subscribe to Elder's Motive for more truth like this. Leave a comment with a number 1 if this spoke to you. And if you are ready to reclaim your life, start with 10 minutes. Just you and your breath. You may be surprised at what returns. This is Dr. Mason R. Holbrook, and I believe in your strength. Stay alive. Stay connected. Stay with us.